So I just read a really concerning article on the CBC that is talking about the fact that Trudeau's Liberal government is, quote, considering introducing legislation to make it an offense to knowingly spread misinformation that could harm people related to the COVID-19 crisis. Now, on the surface, this sounds like a very laudable objective. There's no doubt that there is information circulating with regard to various compounds or things that make claims that could cure COVID, that people are trying to make money off of. Okay, but to have to pass legislation on what is deemed the truth is very concerning to me in this situation, because who is actually determining what the truth is in this situation? You know, I've sat in the House of Commons. I remember at the end of January when we started questioning the government on their response to COVID-19. If you look back through the question period archives, you'll note that some of my colleagues asked the government, are you quarantining people that are coming off of flights from China, when we saw that Hubei province was a hot zone? And, the response back was, well, of course not. That's crazy. And I actually even remember at that time, the WHO was saying that there was no evidence of human-to-human transmission. So I'm just going to read through some of the flip-flops that have happened from people who are deemed to be arbiters of truth on the COVID-19 crisis in the last several weeks. So you'll remember at the beginning of March, when countries around the world were making decisions to close their borders, given the spread of COVID. On March the 5th, Justin Trudeau said that Canada had chosen a different approach on borders to other countries. March 13th, he said he was not closing the border. And even in that time period, he was citing WHO information saying that closing borders didn't help stop the spread of the virus. Then on March 16th, he closed the border. So think about that 2-week time period when, infection was spreading across the globe. If they wanted to impose a law that said that you couldn't spread misinformation about COVID, would questioning the WHO and Trudeau during that time period saying like, hey, maybe we should close our borders, which we ended up having to do anyways, a day late and a dollar short, would that have been criminal? Then, another example, the whole issue of whether or not homemade masks or cloth masks should be worn in public as to prevent the spread of the disease. You'll remember, or the virus, you'll remember that towards the end of March, Dr. Tam was questioned numerous times in public, in her press conferences, should we be wearing masks? And there's no evidence that, cloth or homemade masks do anything to stop the spread of the virus. Meanwhile, there was, study after study and advice after advice from credible medical professionals around the world saying, actually wearing a homemade mask can help prevent the spread of the virus, and you should be doing that. And then, of course, the Dr. Tam and Trudeau flip-flopped on that. So under this law, would questioning whether or not somebody should be wearing a cloth mask, would that have been misinformation? There are a lot of serious questions that need to be asked about the WHO's response to this, the information that came out of the WHO, especially on the front end of this pandemic. So if they are the arbiter of the truth, would questioning them be criminal under these laws? I want to stop for a second, because we have so many agencies in Canada and different regulations that prevent Canadians from being harmed by false information. So for example, let's go back to perhaps drugs or compounds that, if there's medical claims that they cure a disease, we have agencies in Canada that test compounds and approve usages. We can have a whole conversation about whether or not they're doing that quickly enough right now with certain compounds, but there's something in place to protect Canadians. I think that in any situation, we have to be very wary about the government wanting to put limits on speech, especially with regard to the government's response to the COVID-19 crisis. There's so many things that we don't know right now, that we're waiting for quantitative, scientifically verified data to be presented both to Parliament and to the Canadian public, that to shut down thought or questioning of this through a law is especially under the auspices, right? It sounds really nice, like we want to protect Canadians from misinformation. Well, that assumes, number one, that Canadians are dumb. We're not. I don't want the government to take away our ability to question these things, because it's really important. The article that I am citing, it's published on the CBC this morning. One of the examples that they use in it, and this is going to be controversial for me to say, I'm just going to find the quote in here. It is about the origin of the virus. So in it, one of the examples that they use for misinformation is saying that essentially saying that the virus might have come from somewhere other than the wet markets in Hubei. Yet the Washington Post very recently, I believe it was either yesterday or today, talked about, they published, this is the Washington Post, it's not me, they put out an article talking about how there were concerns from a certain facility in a certain country with regard to their virus containment protocol. Would it, under Justin Trudeau, given that this is an example that they used, would it be illegal to retweet a Washington Post article? That's the slippery slope that these types of laws that are designed to protect people go down. And I think that we have to fight them vigorously. There are so many different ways that we can protect the health and safety of Canadians, but taking away their ability to rationally and calmly question the government's response or the World Health Organization's response to this is not the right thing to do. It's wrong. And any legislator who is telling you otherwise, you should be questioning their motives. The other thing is, I'll just reiterate this, I don't support laws that assume that people are stupid. Regulating free speech, under the guise of protecting Canadians from themselves is inherently, it's infantilizing the ability of Canadians, or it's making assumptions about the ability of Canadians to think for themselves. And I just think that that's wrong. I just think that it's ridiculous. I see that the NDP are in here and they're saying, yeah, absolutely, we need to, stop people from, spreading misinformation without really defining what that means. And that's very concerning. So if there are, products that are being circulated that are harming Canadians, that are claimed to be, therapeutics for COVID, okay, we have mechanisms to deal with that through Health Canada. If there are people who are undertaking fraud through scams, we have criminal laws that can take care of that. But I think that we have to start understanding that Canadians have the capacity to think for themselves and underscore that, and also fight back against, this is shocking. No, I'm sorry, Justin Trudeau, you don't get to tell me or Canadians what the truth is when it comes to COVID, because you flip-flopped so many times. I want health data. I want data from scientists. I want to be able to scrutinize that. And I want to be able to question your response and that of the WHO. Read this article on the CBC. When I post this video to YouTube, I'm going to post a little video compilation of their flip-flops right after this segment so that you can see exactly what I'm talking about. Working hard for you. Please share this video and hopefully not get criminalized for it. Have a great day.
Well, I understand that there's some voices that would say that we should shut down the border to China. But I would say that Canada is following expert advice from the World Health Organization and working closely with allied partners like France and the UK and Germany, who have decided to take a different approach than the approach that the Australians and Americans have taken for a whole bunch of reasons. First being that it's much easier to support people from a region that's experienced such an outbreak if we know where they're coming from. And the evidence says that when you shut down a border like that, it gets much harder to actually detect where people are coming from, because people are determined to get into a country or return home, and they will find alternative routes to do so.
Canada has been following the recommendations of the WHO and indeed leading around the WHO tables on what the best paths are to take. There are a number of countries that have made different choices, but we are confident that what we have done in Canada Canada. What we continue to do in Canada is right for Canada.
We are looking to reduce the number of airports that will accept travelers from overseas in order to be able to give the proper resources on all arrivals to ensure that we're doing everything we can to keep Canadians and Canada safe. We will be denying entry to Canada to people who are not Canadian citizens or permanent residents.
Putting a mask on an asymptomatic person is not beneficial. Well, we'll always evaluate new data as it comes along. Our position right now is that put a mask on someone with symptoms if they should need essential services. Like if you have symptoms, you have to stay at home. You should not be wandering around the community. If you need to get to a medical facility, at that point in time, that mask might actually be useful because you now have infectious droplets that you might send to others. But the key is to keep that 2 meter distance. Masks have to be utilized appropriately too. Most people haven't learned how to use masks. So there's many practical aspects of this. So our advice right now is there is no need to use a mask for well people.